6th to 24th June 2023. Research has shown that cleft is the third most common birth defect worldwide, and every 3 minutes in the world, a child is born with a cleft. In the studio with me this morning to throw some more light on this year's campaign, I've been joined by Clement Ofosuhiming. He's a patient coordinator at Operation Smile Ghana. Clement, thank you for making the time. Why this particular partnership with GTV? Why did you decide to go this way?
All right, thank you so much. A big thanks to GTV for the opportunity given us. I think Operation Smile Ghana, we started 2011. And right from 2011, GTV has been our strong partner. I think GTV really knows that corporate social responsibility is a key thing to consider. And from inception, they've been a strong partner to us. That's why we want to bring them on board. Yeah.
So tell us what this condition is all about. Cleft lip, it's when there's a gap in the mouth somewhere. What's the medical explanation for this?
All right, medically, when you say cleft, it simply means a gap. That is an opening. So cleft lip simply means patients who are born with a gap that extends to the nose. And then cleft palate means a hole on the upper part of the mouth. So when they open the mouth, you see an unusual hole on the upper part. So when they speak, it comes from their nose. When they eat and they bow down, you see the food coming out of the nose. That's cleft palate. Yeah.
How is this? What's the cause of this? How does it happen?
Right. Doctors cannot really put a strong point to say that this is the cause of it. But research has shown that there are several factors that we believe contribute to that. I mean, when you get pregnant, you need to go for antenatal care. Some of our people don't do that, you know. And then again, when we have instances where you see patients who have traces of cleft, you see someone giving birth with cleft in the family. So it's more like genetic. So you see that when you trace the family, you see such cases reoccurring, you know. And then we have other instances where exposure to chemicals. You know, government is making strong campaign against galamsey. And some of these chemicals, when they come into contact with water, it brings down repercussions. So we believe that all these things are contributing factors that could be a cause of cleft. Pollution could be one of the factors. Some of them take excessive alcohol. Because when you're having interactions with them, you see that these are some of the traces. You see some of these things popping up when you are interfacing with the caregivers.
So is there anything someone can do in order to avoid having a child who has the deformity, or is once you get it, you get it? Is that the end of it?
Well, once you get cleft, that is why Operation Smile Ghana is here to get it fixed for you.
But there's nothing you can do to avoid getting a child with cleft or being born with cleft in the first place. So anything the parents can do whilst pregnant to ensure that the condition does not present itself at birth?
When you get pregnant, try to go to antenatal care. Number one. Number two, when you are not feeling well, go to hospital. You shouldn't be taking drugs that has not been prescribed by a doctor. You know, all these things are very key things to take notes. And again, abortion too is believed to be a contributing factor. You know, sometimes they take in drug. Maybe they don't know that the one doesn't know that she is pregnant. So she'll be taking drugs that are not meant for her. And you see blood coming out, you'll be saying, oh, this blood, you don't know that that could be a contributing factor to the cleft case.
Is surgery the only way to remedy the situation?
Yeah.
And how much does this surgery cost?
It is within the ranges of 7 to 10,000, 70 to 10,000.
Is it a treatment that's readily available at some health centers? So if not for Operation Smile, is cleft surgery very, very popular and open to people across our health centers?
Yeah, cleft, you know, when you go to main hospitals like Kolebu, Konfanochi, and you have this case, they can get it fixed for you, but it comes with a cost. But with Operation Smile Ghana, we are doing this free. We don't want to charge anything. It's basically free.
And how are you selecting people to be a part of this campaign?
Everybody is welcome. Everybody is welcome on board. Because you see, we have so many people that bring their effort together to be able to help us get where we are now. We have volunteers, medical volunteers, and non-medical volunteers. We have partners like GTV that are supporting us. We have nurses that are coming from the diaspora. And we have partners who also sponsor us. So everyone is welcome. I mean, I'm saying that if you have someone, maybe you may not have someone with cleft, but through you, somewhere, somehow, someone who's having that deformity will get that opportunity. So I want to use this platform to say that if you know anyone with this condition, kindly reach out to us and we will come to their aid to get the surgery done for them free.
Okay, I'll ask you to share a contact towards the end of the interview, but where do people go? Someone is watching and the person might know someone who may be in need of this free surgery that you are offering. What should they do?
All right. Kindly reach out to Operation Smile. This is one of our hotline, 0241 91 71 37. I repeat, 0241 91 71 37. 050 240 7860. 050 240 7860.
And what's the procedure? Once they call, what should they expect?
The first thing for us as a foundation is to have interface with the patient to see if it is indeed cleft. Once we can confirm that it's cleft, what we do is that we take their details and then we register them. Now the first thing to do is to get them enrolled in our nutrition program. So if the patient is 5 years and below, we give them nutritional support to enable them attain the required weight for surgery to be done, among other things, be it the HB, among other things. And right after the nutrition clinic, we also organize the surgery. Once you are flagged, you pass through the screening, we flag that you are good to get surgery done, surgery is done. And that we pay it free, we don't charge anything. Apart from the surgery, if it is a lip, you need to focus on the palate. Some comes with the lip as well as the palate. So the palate is the whole, as I said earlier on. That one also, we get the surgery done for you. And when that is done, it's not complete. You know, we said we give 360 comprehensive cleft care, which means that, you know, cleft comes with other conditions. You know, sometimes they have breathing challenges, they have speech impairment. So we take them through dental, speech assessment to ascertain if such conditions are there. Once it is there, we give them the necessary attention and that is addressed.
And all that is free?
All that is free.
So if I understand you correctly, you take the details, you get the person registered onto your scheme, you offer nutritional support, and then you do the screening and then surgery, and then whatever other aftercare is required. All this is free. There's no point where a patient has to pay anything.
In fact, I need to add more to it. Apart from the free surgery we provide, we also give monthly nutritional support. That is one. And when they come for the program, we give them free accommodation. We give them free meals for the patient and one person who accompanies them. Now, when surgery is done, their transport reimbursement is also given to them free. Our main goal is to make sure that nothing will be a hindrance to prevent them from getting the needed surgery. So all the bottlenecks is taken care of by the organization, and all is done free.
Where does this surgery happen? So do you have a base where everyone is taken to and kept until the procedure is done and the follow-up and everything is completed?
Okay, let me throw more light on what is ahead of us right now. We have a mission coming that is the 15th to 24th at Cleft Regional Hospital. So all our patients that we deem fit to receive surgery will be bused from their regional capitals to Cleft Teaching Regional Hospital. That's where we'll have the surgery done. And apart from that, we also have established a strong partnership with Kolebu Plastic Unit, where patients on weekly basis are rolled to the plastic unit and surgery is done, and we foot all the bill by our medical team. We have a strong medical team that are part of us, who are also based in Kolebu as well as other facilities, and we take care of that.
What kind of challenges do you have or do you encounter as you go about some of these operations, and in what ways can people support you?
All right. I think one of the things is stigma. Sometimes, you know, people share derogatory remarks about people having this condition. So they are rejected, isolated. They don't have the confidence that you and I have to come to public places. So I want to use this platform to tell everyone that please do not stigmatize against cleft children. They are human beings like you and I. Once you have heard about Operation Smile and what we're talking about right now, share on your all platforms. Maybe somewhere, somehow, someone will get to know through your input. And again, we want to use this platform to tell all people who are willing to support us. I mean, we're doing it free, but again, if you have anything in kind or cash, we are open to get it and spread our tentacles wide. Yeah.
And they can also call those same numbers that you gave us if they have any support to offer?
Sure, they can call the numbers that we have on our screen, and we'll be able to receive them very well.
Right, we'll be rising shortly, but summarize it for us. What's going to happen from the 15th to the 24th of June? Is it the registration process that will start, or is it the actual surgeries that will be taking place? Because 15th June is just next week, I believe.
Yeah, 15th June to 24th June is the main mission that we are going to do. But registrations are ongoing even after that. Because like I said, apart from the main mission that we are about to embark on.
So when you say main mission, that's
the Koforidia mission I'm talking about.
Okay.
That is from 15th to 24th of June. Apart from that, continuously on weekly basis, all our patients that we receive on our outlet, we make sure that we roll them to Kolebu when they are due for surgery, and surgery is done. That's why we have that strong partnership with Ben's unit.
So 15th to 24th of June, it's happening at the Kofodia Regional Hospital, free cleft surgery for children and adults. And this is a partnership that Operation Smile is doing with GTV. We are proud partners of this program, started way back in 2011. And Operation Smile is giving you the opportunity to get your cleft palate or lips surgery for free. Ideally, under normal circumstances, you would spend 7,000 to 10,000 Ghana cedis, as Clement is just telling us. But this is an opportunity for you to get it for free. So you get your details taken. There's a registration process. Nutritional support will be offered to you. You also undergo some screening. Remember that as you're doing this, you'll also be benefit to a monthly nutritional support program. You get free accommodation, free transport, and free food. And you just have to stick to the program. Operation Smile will pay for everything. So if you know someone, or you yourself require that kind of surgery, or a child you know requires that surgery, you may want to grab your phone and take these numbers down: 0241 917134. That's 0241 917137. And you can also call 05024078060. That's 05024078060. Clement Ofosu Hemeng is the patient coordinator at Operation Smile Ghana. Your final word, and then we go.
Fellow Ghanaians, we have a big opportunity, and that is Operation Smile Ghana. When you come across a child having this condition, please do not stigmatize against them. Kindly share our numbers: 050 240 7860, 050 240 7860, 0241 917137, 0241 917137. If you have people who are being touched by what we're talking about, and you want to support us, we welcome you. Call the hotline and we will receive you very well. And GTV, big thank you to you. I mean, like I said earlier on, from day one, you have always been supporting us, and you don't even charge us. So basically, all we owe you is a big thank you.
Thank you, Clement, and we wish you the very best.
Thank you
for this campaign. Clement Ofosu Hemeng is the patient coordinator, Operation Smile Ghana. We're going to put all the numbers on our social media handles, GTV Ghana. If you're not following us already, you should. And if you need this service, call them and they will offer you some support for free. If you are not able to be dealt with in this window from the 15th to the 24th of June, which is happening at the Kofodia Regional Hospital, they will still be able to take your details and refer you to some other health facility and pay for you to get that surgery for free. Operation Smile believes that everyone should have a smile on their face, and it's something that GBC also believes quite strongly. So we'll take a quick break, give you some time to process the information we've just given you. And when we come back, we'll be talking some more topical issues right here on GTV Breakfast after the break.